Okay. Good afternoon, everyone, and welcome to part 2 of our Chapel Hill-Carrboro NAACP Law Enforcement Community Update. I want to introduce, we have some special guests today, and so I want to introduce them. If you'll go to the next chart there, I think we have some introductions. I want to welcome, of course, Chief Blue, who was the respondent to our agenda questions, and he was here with me, Anna Richards, on our first part of this update. And today, because we didn't get all the way through the agenda, and because we're talking about two really important aspects of our 6-point agenda, community investment and also reimagining justice, we're really honored to have with us District Attorney Jim Woodall, and also we have Kate Finhagen, both of whom are involved in some very interesting ways of dealing with some of these issues in our community. Jim also, in addition to serving as our district attorney, is also a part of the governor's task force. And so when we talk about transformation and moving forward in a reimagined way with justice, we'll be able to get some insights from him about what we can look forward to and some of the changes that are already in place. So without further ado, we are going to get started. So you'll, let's see. Okay, next chart. So I'm going to just quickly, just kind of as a reminder, talk about our the things we covered last time. We had a good discussion about use of force. We also, this chart talks about our transparency and data collection, and we talked about some of the things that would be necessary to have transformation in both those areas. And then the third agenda item is on the hiring and retention of officers. So that's our agenda item 3, hiring and retention. And we talked about what it would take for transformative actions here in terms of how we hire and how we retain and develop officers that would represent the values in our community. So again, we're not going to go back over this content. We did record the last session, and if you're interested, if you weren't on the first session when we talked in depth about these 3 elements of our agenda, again, use of force, transparency and data collection, and hiring and retention of officers, I invite you to go out on our website, which is Chapel Hill-Carrboro NAACP.com, and we do have a link to those to that recording out there where you can hear the whole in-depth conversation. So I think Margaret also just put that in the chat. So if you're wanting that, you can have a look at it at your leisure. So today, the exciting part, we're going to delve more into community investment. So our invest in communities, let's talk about what we included in our agenda. What we talked about there was, thank you, I think you're there now. We talked about what is the right size of police budgets. And in Chapel Hill, our town council has asked that until the task force newly formed come back, that we not expand police budgets. So we're taking a look at what the right size is for our budgets here, and we look forward to that work coming forward. The promoting of community policing is kind of a controversial issue for some folks, but the end result in many cases of what has been known as community policing over the years is that there's been an over-policing of Black and brown neighborhoods. And so when we talk about community policing in this sense, we're saying, let's not over-police Black and brown neighborhoods. If we're talking about community policing, that's something that should improve the quality of life in all of our communities. We're asking that neighborhoods and the folks in neighborhoods be involved in municipal decision making. And that includes in our community, we're saying we should invest in community-based solutions for crisis units and other ways to expand our harm reduction techniques and look at other ways that we can deflect people from the criminal justice system as opposed to bringing people into the system. On the next chart, we continue with other ideas about investing in communities, and they are to fund violence prevention programs and intervention programs, and to support the community understanding what their role is in intervening in violent situations. We understood that housing and the lack of housing, homelessness is a growing issue across the country, and as well as in our community. And so we made several recommendations about how we might support ending homelessness in our community, with particular attention to young people who we find make up a large percentage of the homeless population, and they are battling difficult situations because of their gender identity and rejection of them from some of the support systems that we might normally expect in our families and in our communities. And so we're looking especially for options for young people who are experiencing abuse or rejection because of their identity. And then the last chart, I think this is the last one, really talks about how we can keep people housed properly through eviction diversion programs, mediation and funding, and prioritizing our city funding toward infrastructure, supporting mental health, wellness, neighborhood-based trauma centers, and making these services available to those who may not be able to afford them. And overall investing in youth programs and in institutions that support youth, like our educational institutions and the family structures, so that we're investing in those programs. The underlying belief in all these things around investing in community is that if we can support our families, if we can support our citizens, if we can support our young people, that these are the things that make our community stronger. So the next chart takes a look at those items that we talked about on the one side of the page where we're saying invest in communities. And on the other side, we have our Chapel Hill Police Department response. And so I'm going to let Chief Blue talk through the his response to these items. And those of you who were here last time, we're going to follow the same format. On this particular issue, we're going to let Chief Blue talk about his specific response to those items. And then today, because we do have Kate with us, we're going to talk about some of the ways within Orange County and Chapel Hill we are investing in our communities today through a couple unique programs. And then we'll open up the mic for Q&A. So if you have questions, please put them in the chat, raise your hand using the raise the hand feature. And once we get through this segment of the presentation, we'll have lots of times for questions and answers. So go ahead, Chief Blue, you want to talk to us about your response to invest in communities?
Sure. Thank you, Anna. And thank you for, again, hosting these important conversations. We're appreciative of the opportunity to be here and be a part of the community discussion. I'm just going to kind of go through each bullet and share some highlights from our response. You mentioned earlier that our council passed a resolution back in June that kind of charted our way forward around reimagining community safety for what I would imagine would be the next year and beyond. And there were a lot of elements in that resolution. We talked about some of those last time, and we'll talk more about them today. One key element was to not increase any police hiring and to freeze our positions while we figure out exactly what the right size of our police force might be in Chapel Hill. And I think, I have some ideas about that, but I think it's also important to hear from our community and hear from our task force and get a sense of exactly what alternatives there may be out there that would help us maybe minimize or reduce the need to call 911 and involve police officers. And a big part of that is what Kate will talk about in a few minutes. So we certainly are supportive of the notion that let's hold our staffing right now and let's think about what the right police force size is for our community. There are a lot of different formulas out there that communities use and the police departments use to decide on what staffing looks like, but ultimately it's, I think, very much comes down to what your local community needs and what they expect out of the police force. And so we look forward to that discussion. I think it's important. I want to talk a little bit about community policing, because as you mentioned, Anna, that's a term that means if you ask 100 different people what they think that means, you'll get at least 100 answers. And I would say that our philosophy about, first off, community policing is not a unit of people you assign to do special kinds of police work, at least not in my opinion. It's a philosophy. It's a philosophy of relationship building and trust building and outreach and problem solving in a way that the community supports and expects. A very wise mentor of mine several police chiefs ago, Greg Jarvis, told me early in my career that the way you police ought to be almost solely dictated by what your community expects from your organization. And so much of how we learn those expectations is through community engagement and outreach. Pre-COVID, I would say that we averaged somewhere between 175 and 200 community outreach opportunities every single year in our department. That can range from a coffee with a cop to a neighborhood watch meeting, to speaking to a group of school children, to speaking to an NAACP chapter meeting. And everything in between there. And those are great opportunities for relationship building and to build community, and most importantly, to hear what our community expects from us. So I think it will be interesting as the council's appointed task force gets up and running, and council did just make those appointments at their business meeting last week. So we've got an exciting group of folks who I think are going to do a great job in engaging our community throughout the fall and beyond. I think a big part of what community policing looks like in Chapel Hill will be informed by the things that they hear from our community. So we're excited about that. I just want to quickly touch on visibility of data in policing decisions. And I hope that's something that and I believe the task force will spend a lot of time talking about this too, because our council has asked us to assemble lots and lots of data about how we do our work and outcomes of that work. You can find that on the town website. And there is a dedicated web page that will kind of follow the task force and their work and have updates and include enhanced information as the task force moves along through their work. We know an awful lot of what we do is not measured, and when it's not measured, you don't necessarily have a chance to evaluate whether it's effective or not, or whether it lines up with community interests. So we're appreciative of the opportunity to take another look at the things that we are monitoring and try to determine whether those are useful to the community or not, and whether they in fact are informing how we do our work. We do a quarterly report that we publish that has lots of information in it. It's always about 6 or 8 months behind because it takes a long time to compile and analyze and produce that. But it will also be interesting to hear from our community over the next few months whether that's a useful document for them or not, or how it might be improved, because there's a lot of information in there, but if you don't know what you're looking at, you may not make much sense of it. So we're interested in getting feedback on that and making sure that's something that is meaningful to folks. I think the last thing I would say before I hit on the harm reduction model and some of the opportunities there, it just kind of comes to one part of the agenda is around supporting the involvement of how residents connect in their neighborhoods and how we support that effort. Having been early in my career and for a number of years very much involved in community outreach, I do miss those days of neighborhood watch meetings all over Chapel Hill. In every different neighborhood, we would get together in people's living rooms or at the community center or at Hargraves and talk about what's going on in the neighborhood. And that was a chance to really dial in, kind of going back to that point about what should policing look like in your community. And in some ways, you could get even more surgical about it through those meetings and talk about what policing should look like in that neighborhood. And those were really valuable relationship building opportunities. In the era of Zoom and cell phones, there's a different kind of communication opportunity, but I don't find us getting together in people's living rooms as much as we used to, and look forward to maybe revisiting some of that going forward. That's a good way to build trust and build relationships and really get good unfiltered information. We'll talk just a little bit about the harm reduction model just as a philosophy as well, and then you'll get to hear from Kate more specifically in a few minutes. I think in Orange County, we've been ahead of the curve in many ways with respect to harm reduction kinds of philosophies, whether that's the use of naloxone in the hands of first responders, and we have innumerable overdose reversals in Orange County over the last, 6 or 8 years that first responders have been carrying naloxone. We're early adopters of teen court program in Orange. We're early adopters of pre-arrest diversion programs, CIT training, and lots of other ways to divert people out of the criminal justice system and to reduce interactions with law enforcement, quite honestly. And so I do think there's a lot of work still to be done there. But I also think that Orange County has and will continue to serve as a model in many, many ways. I'm going to come down to the next slide and say a little bit more about CHPD's response, and that maybe will segue nicely to Kate. I'll just say, we talked a little bit about this on the last call, and I think I made a hard plug then for continued support for street outreach work. One of the things our council asked us to assemble in their resolution that they passed was a list of all of the different kinds of local ordinances that tend to criminalize poverty and also tend to involve law enforcement in encounters that are rarely productive, quite honestly. And so many of those kinds of ordinances, whether it's panhandling or sleeping on a bench or urinating in an alleyway, quite honestly, tend to be crimes that are disproportionately enforced on folks who are living unsheltered. But we also know that those are folks who are unsupported in many, many ways. And although I have and will during this call say a lot of things about our police crisis, their ability to do outreach, that's not their sole function. So I have been excited with the idea that the county would be able to fund and stand up a street outreach unit. They were able to secure grant funding for the first year, and I think we'll all need to step up and think about how we can support that program going forward. But what we know is an awful lot of what we've said in our careers, those of us who were career police officers, is when you don't know what else to do, call 911. We'll come and we'll try to figure it out. And for a long time, that I felt really good saying that. But increasingly, I understand that, you know, the tools that we bring to the table are fairly limited, and we've got to find ways for people to solve community problems without calling 911. We're going to come and do the best we can, but we certainly appreciate that there are other resources out there where we can do a handoff, and better outcomes tend to result there. So let me stop for a second, and Anna, turn it back to you, see if we want to do questions here or if we want Kate to jump in.
Okay, I think what'll be good, let's have Kate talk about the partnership activities that we've embarked on in Orange County. And I think then we can have questions come for both you and Kate as we talk about this program, which I think really is one that has the potential to be transformative in terms of how we allocate resources in our community, which we will have to make a decision about, but also I think is a great effort, or has the potential, we don't know yet because it's brand new, to reduce criminal justice involvement for some of our population. So with that, we'd like to ask Chris Finhagen to join us in the conversation.
Thank you, Anna. I hope you all can hear me. Chief, do you have some slides you want to put up? I think you have them. If not, I can share also. So I'm Kate Finhagen. I'm the Criminal Justice Resource Director for Orange County. It's a department of Orange County government. Our mission is to reduce unnecessary pretrial incarceration, reduce money-based detention, increase deflection from the community, from the criminal justice system, and then also make sure to enhance therapeutic responses and harm reduction responses for people experiencing behavioral health issues that frequently come into contact with our criminal justice system. And I just want to thank Anna for all of the work you have done, and I want to thank the town council for all of the work they have done with their resolution and the task force work that's going to come. It's interesting, having been a criminal defense attorney, to find myself nodding my head at absolutely everything Chief Blue was saying, and I am going to probably do the same when District Attorney Woodall speaks to us about all of the things that he is working on with the governor's task force. So do you need me to share my screen, Chief?
I hope it's up. Are the slides up?
No, I think it's still the community update.
Okay, hang on a sec. Let me see if I can fix that. And if not, I will let you take over, but I think I got it. Is that better?
It's about to start, I think. There we go. All right, I can do a slideshow. There we go.
Okay.
Fantastic. You can go to the second. Oh, well, I'll tell you that. So this is called the Street Outreach, Harm Reduction, and Deflection Program. Acronym just happens to be so rad. It's a little cutesy for sure, but it is actually the acronym, and we do think it's a little bit radical, so we're excited by it. So we can go to the next slide. So this has been, street outreach is not something that has just come into our framework recently. This is something that we've had previously in our community when the Housing for New Hope had a program here. It's a little bit different than this program that we're introducing, but it's something that worked, and it's something that has been discussed at length among a lot of stakeholders in the mental health system, in the public health system, and in the criminal justice system. We had a very large gathering that was facilitated by the Department of Health and Human Services back in April of 2019. It was called the Orange County Sequential Intercept Mapping Process. We looked at all the different ways that folks with behavioral health issues intersect with law enforcement and the criminal justice system, and we looked at what things are in place in Orange County. We have a lot of great resources already in Orange County, but we also had some gaps. And one of those gaps was definitely housing. and case management for some of the folks who we are seeing coming in and out of our criminal justice system with behavioral health issues, a crisis facility, a day center, and street outreach, and greater deflection from the criminal justice system. So those were all gaps that came out of that large meeting of stakeholders. We also, as many of you may have already seen, Corey Root has been working tirelessly on the homeless system gaps analysis, and that has identified street outreach as one of their main gaps. And it's important to sort of look at all the other gaps, because this is just one gap we're looking at here filling, and there's so many more that are critical if we really want to address homelessness. And I appreciate what Chief Blue said earlier about making sure that we support not just this program, but all programs that will help address the gaps in our community. Jim Woodall is here. He and I have worked very closely along with all the law enforcement chiefs to create a pre-arrest diversion and deflection program. It's called OCPAD. It previously just was for first offenders, but what it does is allow law enforcement at their discretion to deflect people completely from the criminal justice system after committing low-level offenses. Those people never get a charge on their record. They are immediately connected with a social worker who works in our department, and they engage in programming and collateral consequence education. And as long as they follow through and there's no new law enforcement contact, then no charge is ever filed and they never get anything on their record. So it's been wildly successful in terms of the people who have been deflected by law enforcement. We have close to 100% success with our participants. So, and it's, you know, again, we're seeing a lot of students, UNC students, things like that. What we weren't seeing is our population that is experiencing homelessness and frequent criminal justice involvement, and that's because it's a first offender program. So our advisory committee of OCPAD got together and said, this is a group we really want to serve. And deflect these people from the criminal justice system, because we're not doing anything for them. They're getting a citation for second-degree trespass. They're missing their court date. They're getting an order for arrest with a cash bond attached to it. Then they're coming into our jail on a second-degree trespass, and then they're getting released the next day with another conviction on their record, but absolutely no intervention or services, more convictions, and nothing has changed in terms of the underlying behavioral health issues or their homelessness. So we knew that was a population that we wanted to try and serve in a much better way and outside the criminal justice system, and even outside of law enforcement. The COVID crisis has only created more of an urgency for this work. We've seen a lot more, an increase in substance use, in mental health. It's not just for our homeless population, it's across the board. So we know that this is a critical time to be responding. And we're also, because of the George Floyd murder, we are looking at how we can reimagine public safety. And in every conversation that I've heard, this issue has come up. Why are law enforcement responding to behavioral health calls? Why can't we have more community investment? Well, this program incorporates all of that. So I'll talk just a little bit about the program quickly, if you want to move to the next slide, Chief Blue. So we were able to apply for an emergency solutions grant, CARES Act grant, for street outreach and harm reduction. It came up because of COVID. And it was a very quick turnaround, but we were able to get it in, and we were fully funded for 1 year. It was about $255,000 for the year. So we began operation just this week, October 5th. It supports 1 clinical harm reduction coordinator and 2 street outreach peer navigators with lived experience. We're so excited about the team that we have in place. We have 2 peer navigators with lived experience, but very different lived experience, who bring, I think, very different perspectives to their work. And we have a clinical coordinator who has graduated from UNC undergrad, but has her master's in mental health counseling and has been working at Holly Springs with some folks with, not Holly Springs, Holly Hill Hospital, with very severe mental illness, and has a deep commitment and passion to work for people experiencing criminal justice involvement and homelessness. So we're excited about the team that we have working together. If you can move to the next slide, Chief Blue. So here, this is how the program works. It uses a trauma-informed and relationship-based model. It provides ongoing engagement with the population that they're working with and ongoing harm reduction. It's going to work with people living unsheltered. So it's not going to be, unfortunately, available to sort of other calls of people, you know, in behavioral health crisis, but it is going to serve this population that's living unsheltered, many of whom, of course, have behavioral health issues. The people are going to be, this team is going to be embedded in the community. They're going to go out to campsites. They're going to go to the Wallace Deck. They're going to go to hospitals. They're going to go to the jail, and they're going to be going to Franklin Street and wherever they need to be to just have direct contact with everyone. They're going to provide connections to housing, food, medical care, treatment services, transportation, and employment. And they're also, because we have the clinical coordinator, able to provide therapeutic assessments, and then ongoing case plans and case management for all three of the members to conduct. They're going to also work very closely in collaboration with the Chapel Hill PD Crisis Unit, who have been very engaged with this population. And they're going to be, you know, working to make sure that they maybe become the responders when community or law enforcement or businesses have an issue with somebody who has behavioral health issues and isn't presenting a significant safety issue. We know that this is going to reduce the policing interaction with these folks, and we know it's going to deflect them from the criminal justice system. I mean, very often the police would be called, somebody's intoxicated, they have no alternative at that point if they've committed a low-level offense to deflect them. And very often what happens is law enforcement has to take them to the jail, charge them with the offense that they committed, and just have them sleep out their intoxication till they're released the next day. We see that often, and we're hoping that that will be drastically reduced with this team in place here. They're going to have hours between 9 and 11 p.m. at night, Monday through Friday, and then Saturday 2 to 11 p.m. at night. So that's based on sort of the call volume that the crisis unit has shared with us about when the needs are. You can go to the next and final slide. I think I already talked about that, the budget. We have to sustain this after this 12 months. We're gonna, in the fall of 2021, we're gonna need to find sustained funding for this program, assuming that it's providing a valuable service, and I truly believe that it will. We're gonna be looking everywhere we can, grant funding, towns, county, government. We did get in-kinds office space from the downtown partnership, so they'll have a space, these three folks will have a office space right down on Franklin Street, so they'll be right there in the community. They also have access to the crisis unit, an office near there, as well as Southern Human Services in order to see clients. CEF as well as another place they can see clients. You know, this is, again, not a panacea, and I don't want anyone to think it is. We think it's an important new program that's going to fill a gap, but it's not the only gap. And I just, you know, remind everyone to look at the Partnership to End Homelessness and consider the other gaps that are there, because these will only support the street outreach program moving forward. But they will be out on the street starting October 19th. They're doing a lot of onboarding right now, and I look forward to coming back and sort of talking, introducing you to the team at some point, and telling you about the work that they're doing. So thank you.
Well, thank you so much, Kate. You're right, it doesn't meet every need, but it is certainly filling a gap that's been identified for a while with this population. And so it is a fine example of the kind of investment in our community that we're promoting through our agenda. You know, we look further at folks who aren't homeless, who are having behavioral health issues as well. So we know that there are other gaps still existing, but I think when we talk about things we can do to invest in our community and our citizens, this is one example of what really is rad, I think, and can be considered transformational in terms of how we deal with this population. Very exciting. So at this point, I don't see any questions in the chat. Let me see if I have any hands raised. But here's your opportunity, folks, to talk, ask both Chief Blue and Kate questions about anything you've heard on investing in the community. I'm gonna pause for a second. I'm looking at my at the participants to see if we have any hands raised. And we do not at this time. So I'm going to ask a question of Chief Blue. Okay, I do see one hand. Great. We have a question from Trinity Casimir, and your mic has been your mic is now open.
Okay, thank you. I just had a question. I was a little bit confused about the crisis unit. So is it going to be like the SORAD program, is there going to be a transition from the CHPD crisis unit's involvement to eventually it being the SORAD, or is it going to be sort of like an ongoing partnership? Or I'm just kind of thinking about like how substantive is SORAD involvement going to be when it comes to answering 911 calls?
Let me take a stab at it, and I think some of the answer is we're going to figure that out as they get up and running in some ways, but I'll give you an example. I was meeting with some merchants week before last on this very subject, and the notion that they could have a number other than 911 to call when they observe someone who needs some support was very appealing to them and to us too. So I think right away, when these folks are ready to start responding, which I think, Kate, you can say exactly when it is, I know it's imminent, right away, we're gonna start to see some transition away. There'll still be 911 calls that come in that to which we respond and we recognize here's an opportunity for a handoff or referral. But I believe, particularly in our downtown community, folks are really interested and excited about this program. And I think right away that transition is going to start.
Yeah, I concur, Trinity. I just want to add, I mean, it does not replace the Chapel Hill PD crisis unit. They are doing critical work and will continue to do it, but we'll be an important partner with them. And there will be a number that the community and police can call when there's a need that doesn't involve a significant public safety or crime issue. And most of these don't. Most of them don't. Most of them are calls because somebody is committing a very minor low-level offense outside of business. And that's where we can respond directly, or we can be the handoff that Chief Blue was talking about so that law enforcement doesn't have to take any further steps. They can just hand it off to Street Outreach Program. And they'll also, of course, be doing something that the crisis unit can't do is clinical assessments and ongoing case management and being embedded with this population on a long-term basis.
Okay, thank you. Trinity, if we answered your question, I'm going to ask you to put your hand down so I'll know if we answered your question. And we have a question in the chat from Miriam Thompson for Chief Blue and Kate. Can you remind us of the work and equation of the department's Community Crisis Intervention Program, how it works with the county and community social service partners? And so I think that was part of what was answered in Trinity's question. And then there's a part two. So I don't know, I'll stop there and see if there's anything either of you want to add in terms of the work of the department's Community Crisis Intervention Program and how it works with the county and community social service partners. Anything to add there?
I'll give a 90-second review for those folks who may not know everything about our crisis unit. We do have an embedded 5-person master's level unit of clinicians that function as social workers, and they oftentimes co-respond with law enforcement to cases where there's been trauma, victimization, sexual assault, domestic violence. Like we've talked about homelessness examples here today, and many other matters where, quite honestly, law enforcement may have some value in arriving and stabilizing and assessing, but then our ability to solve that problem may be over. And to have those folks with us and able to hand off to them, at least to stabilize and begin some resource connection, is fantastic. That's something that is very, very unusual in law enforcement. Even all these years after we started ours, it's still unusual. And it is an expensive thing. It's hard for agencies to start one from scratch if they haven't ever had one. So we're very fortunate to have that built into our CHPD DNA. With respect to partnerships, they do an awful lot of that. We have a representative on the partnership to end homelessness. They work very carefully with all the service providers across Orange County, Compass Center, Rape Crisis, and many, many others. So those relationships are invaluable. And again, help us develop that network of problem solvers. So when we respond and recognize this is the police part of this intervention is over, they help us transition those folks to resources for a long-term solution.
So thank you. The second part of Miriam's question was, what data and how collected, and where can we access the data that reveals the success of the diversion programs you enumerated? And I know in the in your response, I think, and also Kate, in your comments, you talked about some of the diversion programs that are underway. Is there a place where the numbers can be easily accessed by our community?
Yeah, so there's data up on the Orange County government website under the Criminal Justice Resource Department, but the most recent OCPAD fiscal year numbers are not up on the website yet. So I will get them up on the website tomorrow, and I'll also send them to you, Anna, if you want to share them with folks on this call.
Okay, great. We can. They're free to be posted, right? We can.
Yes, of course. Yep.
We have a question from Elizabeth Evans, and this is actually a question I had been thinking about. So, will housing be found for the houseless individuals through the SORAD program?
Yeah, thank you for that question, because what's critical about this is it's a partnership between my department, the Criminal Justice Resource Department, and the Housing Department, which includes the Partnership to End Homelessness. So we applied for this grant together. Housing and rapid rehousing is critical to this work. So one of the reasons that they're starting October 5th and not on the street until October 19th is because they are doing a significant deep dive into housing access in Orange County. And there's not sufficient housing, but that is going to be the #1 goal, is to connect them to housing, people who have been resistant to housing, some of whom have not been interested in housing for a long time. We feel that the sort of relationship building effort that's going to go on with this team will help us get to that place. So yes, housing is first and foremost in the mind of the street outreach team, and closely connected to the Partnership to End Homelessness and all of the housing helpline resources that exist. But we need more housing, no question.
So one more question. I think this goes to Chief Blue, and that is, we talked about the diversion program, but is there evaluation or numbers or data on the Chapel Hill Police Department Crisis Intervention Program? So I'm interpreting that, is there data that tells us, how many times the crisis unit is called out, what kind of cases, any data on the crisis program with the CHPD?
There is, and we hope to do even better. We just got a small grant to purchase some software that they'll be able to use that will allow us to get much more granular in evaluating what they're doing and how that's going, how much time they're spending out in the community. We've got some raw numbers that I think we've put on that website I mentioned earlier. I'll verify that after this call. I mean, they go out with us. I'm pulling this out of the sky, so don't hold me to this number. But from where I sit in my office, I see them dispatching with police officers all day long, every day. And perhaps more importantly and interestingly to this discussion is them dispatching without police officers also throughout the day. So look for more granular data analysis on what they're doing, but I will tell you that we've got 5 of them and we could use 5 more today.
All right. And one more question from Trinity. She wanted to know what does supporting engaging with neighborhood councils in terms of tangible examples. So Trinity, I'll take that. That's one of the items that we put in our agenda, and we're wanting neighborhood councils to be a part of decision making. And I in terms of tangible examples, I'm going to defer to, in terms of if this is happening now with any neighborhood councils. Chief Blue, is any of that going on now?
Well, I mentioned earlier kind of the demise of the neighborhood watch group over the years, and that's not a new phenomenon. You're seeing less of that over the last 15 years. That doesn't mean that we don't occasionally get called on an issue-oriented basis to one neighborhood or another to talk about an issue that's of interest to them. But I'm not aware of, I may be missing some, I'm not aware of any standing groups that are regularly engaging on neighborhood-specific problems and engaging the town and the county and other resource providers right now. I miss those days. I think those were outstanding engagement opportunities and relationship building. But just as increasingly, we don't know our neighbors. We also don't get together and solve problems with them the way we used to. So I'm prepared to be educated on that one, but I'm not aware of much of that happening.
And so, thank you. I wasn't either. And so some of what we have in our agenda, a lot of what we have in our agenda is really aspirational in terms of what we think should be going on. And we hope as we go forward and look for alternatives, we may be able to answer those. We're right at a halfway point in our time together today. And I really want to make sure that we have time to talk about Justice Reimagined, which is our other focus for today. And so I do see one more question in terms of the unemployment and underemployment. It's a little bit off. It's certainly part of the crisis, but I think I'm going to defer that and go into our next agenda item that we're going to talk about today, which is the Justice Reimagined. I will note, I know some of you who've seen the whole 6-part agenda, that this is item number 6 and not item number 5. Item number 5 is about SROs in our schools, and we're not going to spend time on that one today. We've had, the branches had one co-sponsored a conversation on counselors, not cops, as well as our youth council this past week had a second conversation about that. And so it was, it's an ongoing conversation. We actually, I'll say this out loud because we have just recently written a note to the school board who had indicated that they were going to form a task force to look at alternatives to SROs. That task force is yet to be formed, and it's kind of a disappointment to our community efforts, because we were very heartened when we heard that a task force to look at alternatives was going to come about, but as of yet there isn't one. So we're hoping that the school board is going to be seriously looking at alternatives, and we stand at the ready to be a part of that process. So with that, I'm going to shift over to our Reimagine Justice. And thank you, Chris, for going. Oh, I do have one comment. Thank you. We have so many folks on the line who have good information. May sent a note to everybody saying that the last neighborhood groups that she was aware of were in Northside and Pine Knolls, and she says she misses those days as well. So sounds like there's a gap there, and maybe this is something as we go forward to engage our community in community safety that we can get back to. So thank you so much. I guess I'll just make one more comment. The Chapel Hill Town Council Task Force there was a question asking how representative, and that, you know, we're hoping that the Chapel Hill Town Council Task Force will have a community conversation. So I'm not sure what the answer is to your question. We're assuming that task force will be conducting similar conversations, and we will look forward to that as well. So, all right, Reimagine Justice. So in summary, we didn't go down through the broader charts because we really want to talk about what we're doing and what some of the ways forward on Reimagine Justice. But the elements, summary elements that we think would make a real difference in our justice system are ending money-based pretrial detentions, in sharing data and resources with ICE, ending low-level marijuana possession charges, ending a quota system, making communication and healthcare to those who are incarcerated free, end immigration detention and family separation, and banning the box. I think, is there one more chart on this? Community update, yeah. In addition, we're wanting to repeal or decriminalize local ordinances that criminalize poverty, and refusing to deploy police in relation to instances where that's the case. Also, this issue of mental health crisis and how we deploy police when sending someone with a gun may not be the best answer in a mental health crisis. Ending regulatory stops, and ending the criminalization of gender-based violence. So that's a good list. What do you think? You want to go back up? I think that's the last one on this, the next, yeah. So if you go back up to the first one, Chief, I'm going to turn it over to you so that you can talk about your response to these things. And then really looking forward to hearing from Jim, District Attorney Woodall, on what's going on here in Orange County, as well as some of the activity for change at the state level. Okay, Chris.
All right. I'm going to just focus on a couple of the big areas that are, I think, very much CHPD specific. But I will just say, and I'm sure Mr. Woodall and Kate may jump in too, you know, we're having some interesting recent conversations about lessons learned from COVID with respect to practices that we put in place during COVID to try to minimize interactions where we can, to try to acknowledge the fact that the ability to have court sessions has been challenged. Recognize that putting people in the jail is an opportunity for COVID to spread. And so many of the things that we had been doing around diversion and citations over physical arrests, and thinking long and hard about whether someone could be released on an unsecured bond and so on, we've really doubled down on those during COVID. And I think there'll be opportunities going forward to think about what we learned from COVID that we can continue and maybe Kate and Mr. Woodall will say some more about that. I want to just say a couple things about immigration enforcement, because I know that's a key part of this particular part of the agenda. I think it really bears repeating every opportunity we have that local law enforcement does not, or should not, and in this county, in fact, does not have a role in federal immigration enforcement. There are occasional jail-related immigration contacts that the sheriff can speak to better than I can, but I will say at the municipal policing level, we just have no business nor any interest in being involved in immigration enforcement whatsoever. And that's not a new phenomenon. That's been our philosophy for a long, long time. In pre-COVID, we had an opportunity to do an awful lot of conversation about that, because in partnership with El Centro and St. Thomas More and other churches around the county, every quarter we would get together with folks who were unable to or ineligible for state-issued ID, but who wanted to come together and get some kind of local card that could verify their identity. Every quarter we would get together and with St. Thomas More, El Centro, and local law enforcement, and the folks I'm talking about who sadly are ineligible for a driver's license or even a state-issued ID in North Carolina these days, and talk about the role of local law enforcement and help them apply for and receive this locally verified ID called the Faith ID. And when I say the need is significant, it wouldn't be unusual on one of those Saturday mornings where we're holding one of these sessions for 250 to 300 people show up. Number one, needing this identification, but also interested in being a key contributing part of their community, interacting with local law enforcement. And that gave us a fantastic opportunity to reinforce this point that I said at the outset. Local law enforcement doesn't have any business in the immigration business whatsoever. And so I just probably said enough about that one, but I just want to make that really, really clear. And in fact, we've got policies in place that prohibit our officers from even asking someone what their immigration status is. So we'll take that very seriously. Talked about low-level marijuana possession charges. We know that low-level marijuana is an area where there are disparities in outcomes. If you're an 18-year-old African-American male, chances of caught with a joint in your pocket, the chances of you having a criminal charge is much, much greater than if that same quantity of marijuana is found in the, in the console of a minivan with a 35-year-old mom stopped on a traffic stop. The outcomes just don't lie. For a number of years now, we've de-emphasized and deprioritized marijuana possession charges really across Orange County, and particularly at CHPD. 5 to 7% of all of our criminal charges prior to putting a policy in place around low-level marijuana possession and a strong emphasis on deprioritization, 5 to 7% of our overall charges had to do with marijuana. That now hovers between 3 and 4%. So we've brought the numbers down, which is good. And we're talking about raw numbers of, maybe a dozen or 20 a year, which in a college community is pretty remarkable. But what we do know that where they are happening, there's still disparity built in there. We have been having a lot of conversations with all of the agency heads and Mr. Woodall the last few months about standardizing that deprioritization plan across every agency and every community, so we're all behaving the same way. And I think those conversations are going well. Also, as is Mr. Woodall, I'm a member of NCCRED, North Carolina Commission on Racial and Ethnic Disparities. We are about to make some recommendations to the governor's task force around decriminalizing small amounts of marijuana. So stay tuned for that. But we just know it's an area where consistently, despite good intentions, consistently we see disparities that are concerning. Let's see what else I want to touch on. We mentioned earlier our council wanting us to take a good hard look at local ordinances that criminalize poverty. So I won't go over that too much again, except to say that we know that a significant number of our law enforcement contacts with the population that the street outreach workers are intended to support are the result of local ordinances that almost exclusively end up criminalizing those folks who don't have any other place to be, and who receive 911 calls about themselves all the time. So that's an area where we're really interested in continuing the conversation about making those ordinances go away and being able instead to respond to those situations with a resource that doesn't criminalize those folks who are simply existing. I think the last thing I'll talk about just quickly is this idea of refusing to deploy police in relation to mental health kinds of crises. And I think that's one where we'll have to continue to work. We know that we need additional mental health resources in our community, even with our police crisis unit, because they're simply a stopgap measure. I think that's a community conversation that's going to need to continue. We also know that there are times that deploying police in order to ensure that things are stable and safe for other providers to respond, those are real situations, and we need to continue to acknowledge that and ensure that we're doing those well, and I think we do. I think the last thing I'll speak to is just Council's action around regulatory stops. In Council's June 24th resolution, where they established a task force and established the way forward with respect to reimagining community safety, one of the things that they also did was immediately end regulatory traffic stops in Chapel Hill, something that we deprioritized for a long time. But where they were still happening, you saw disparities. And we know that regulatory traffic stops disproportionately impact poor people and communities of color time and time and time again. And these are those low-level, non-safety related traffic stops. What we used to call them back when I was out on the street was loose piece of chrome traffic stops. And what we know is that the North Carolina Motor Vehicle Code is about that thick. And so if you want to stop a car and you know that code well, chances are good you'll find some violation on any car that's out there. And much of the time, those turn out to not be fruitful stops whatsoever, and instead tend to alienate us from the communities we're trying to serve. So that was a powerful move from our council, and so far I have not seen that it makes our community any less safe. So I appreciate that effort, and I think that was a courageous move. I will stop and see if there are questions for me, and I know we want to also give Mr.
Well, I really want to, I'm gonna ask, if you don't mind, Chris, if we can get all the questions at the end again.
Okay.
Kate, we'll have you and District Attorney Woodall take questions together on this segment. And I really want to make sure we get an opportunity to hear, because some of these things are pretty exciting that are going on. And we will talk, I'm monitoring the chat, so we will come back to the chat. If you put a question in there, I promise you're first in line when we come back for Q&A on this topic. So with that, I'd like to introduce and welcome to our community forum, District Attorney Jim Woodall. Thank you for being here, Jim.
Okay, thank you, Anna. And I want to apologize if I'm having a little bit of a Wi-Fi issue. I'm not at home today, and so I'm working with what I have. But again, thank you, Anna, for and the NAACP chapters for helping us put together this conversation. And I also want to mention that both Chief Blue in the law enforcement and criminal justice area and Kate Finhagen have been real leaders in this, going back several years. And I think that's important for everybody to know. One of the things, I am on the North Carolina Task Force for Racial Equity and Criminal Justice. Most people just refer to that as the governor's task force. And one of the real exciting things about the task force is we're looking at a broad range of issues across the state. And when I went through the Reimagine Justice agenda that Anna sent out, virtually everything on that list we are working on. The task force is composed of about 25 members other than staff. It's chaired by a member of the Supreme Court and our Attorney General. We've been divided into working groups to tackle some of the real specific areas of concern, and we're making recommendations to the full task force. We're attempting to implement our recommendations in a variety of ways. We will make some recommendations that can be implemented by the governor through executive orders. Some recommendations can be implemented through the Chief Justice of the Supreme Court. Others will require legislative action. Some will require action by local governments. And there will be some things that can be implemented through policy changes in various agencies. So we've recognized that we have to come at this from a lot of different directions to make change, meaningful change happen. Another exciting thing about our work is that in many of the areas we've touched on, things that have been going on locally in Orange and Chatham counties over the last few years are being held up as examples of things that could be done in other parts of the state. That does not mean that we're doing everything right. It doesn't mean that we've got a lot more work to do. We understand that, but I think it's gratifying that Kate Finhagen, for example, has been a presenter. Several of the things that our Criminal Justice Resource Department does is being used as examples to be implemented statewide. And I think that says a lot about the leadership here in Orange County. Orange County, for example, our local judicial district bar appointed a racial justice task force about 4 years ago. Until just recently, it was the first and only functioning racial justice task force in the state. I'm the co-chair of that. I'm also the co-chair of the North Carolina Commission on Racial and Ethnic Disparities. Chris Blue is also a member of that commission. The Criminal Justice Resource Office that Kate heads is really at the forefront of change in the state. She's participated in trainings across the state. I have gotten her involved over and over again in helping folks in other districts in our state tackle some of these problems. So I think locally we're doing some good things. There are more things that we should do. As I said, the Reimagine Justice agenda you sent out, almost all of these things the governor's task force is working on and we're making recommendations about. I'll tell you that we've made 3 recommendations early on that have already gone out and they've been implemented to some degree in different parts of the state. We made a recommendation that law enforcement has a duty to intervene when they see illegal activity taking place or improper activity by another officer, the prohibition on neck holds, and also we have asked the Supreme Court to issue a rule about the assessment of ability to pay fines and costs prior to levying fines and costs. Those are all very important things. Those recommendations have already been made. We have several dozen more recommendations that we're working on, not only the recommendations, but how those can be implemented. I do want to highlight a couple of things because we've talked about them here. One of the things is the decriminalization of marijuana, the particular working group I'm on, working group number 3, that has been one of our recommendations. And we're trying to work through that process because we want to not only make a recommendation, but we want to make a recommendation that can work. And locally, as Chief Blue said, we've been working on that with all our law enforcement heads. I think that we have really deprioritized low-level marijuana crimes in Orange and Chatham County over the years to the point that we have very, very few cases as far as the raw numbers go. I still think there are great disparities in those cases, and that's the second part of what we're trying to tackle locally and what we'll be trying to tackle on a statewide level. one of the things we've talked about locally, it needs to be not only the Chapel Hill Police Department, but all our agencies need to join in, and we need to agree to do things in the same way. And I think we're going to achieve that. We're going to achieve that in pretty short order, so that here locally, prosecution for small amounts of marijuana will only occur when there's something like a driving while impaired case where the impairing substance might be marijuana and things of that nature. And I think at the state level, I think there is an appetite to tackle the marijuana issue, and because we all see that it has great disparities. So that's something that I do believe will come out of this task force. It will require ultimately legislative change statewide, but I think you'll see that happen. I'm not going to say that'll happen in the very next session of the legislature, but I think it will happen very soon. One of the other things that my working group has been working on, and this was my personal recommendation, I made the recommendation to decriminalize local ordinances. And this is an area where just on Friday, we had a full task force meeting where each of the 4 working groups presented their top recommendations. This was one of my working group's recommendations. And I was struck that whenever you get a group of people together, the 25 diverse individuals we have on that task force, that aspiration meets reality. Because I actually thought having a sunset provision on ordinances and decriminalizing ordinances would be, and I don't want to say easy, I knew that some of the municipal leaders would have issues with it, but I thought it would be something that would get very little discussion, quite frankly. And in fact, it probably got as much discussion as anything we talked about. And the reason for that was, on our task force, we have mayors, people who are members of local boards, and they were very concerned about that recommendation because they think it takes away from local government authority and autonomy, and I understand that. And that's just an example of where pushback to do more work on that particular recommendation. One of the things that we have talked about a great deal, and that Chris and Kate have also talked about, is trying to come up with a way that we are not dialing, that citizens are not dialing 911 for every need that they have, because we feel like we're putting law enforcement in positions that they're not going to be successful. They're not properly trained for some of the jobs we're asking them to do. And there's been a great deal of discussion around this issue, some very good perspectives. And at this point, the working group that's primarily working on that, they are looking at more training, specifically more training for law enforcement, but how to promote statewide the idea of adopting social work divisions like our crisis unit at Chapel Hill. And it seems like something that should be obvious that we should do, and I think everybody on the task force agrees we should do it, but you run into a lot of obstacles. For example, there are so many very small departments in the state that simply don't have the resources and will probably never have the resources to undertake that kind of staffing. There are quite a few. I was shocked at the number of one-person police departments in the state of North Carolina. There are a lot of departments in very small towns. They have one officer who's the chief, who's a patrol officer, who's everything, and they use their local sheriff's department as their backup, and whenever that officer's not duty. So there are a great many challenges in that area. However, It's one of the things that has been prioritized on the governor's task force. So I do think we're going to have some good, strong recommendations come out in that area. And our work is to be finished, at least our initial work, by December 1st. I think we're going to meet that deadline. I've been named to a lot of working groups and a lot of task forces over the years. I've never been on one with such an ambitious schedule. We're meeting a total between our working groups and the full task force around 6 hours per week. And we're doing a lot of work between those meetings to try to hammer out details of the recommendations we're going to be making to the governor. I think one of the important things about this task force that's being chaired by one of our Supreme Court justices, Anita Earl, and by Josh Stein, who's our Attorney General. And I think their input, the weight of their positions will add a lot to our recommendations. I think Governor Cooper is committed to making some real change. I think this task force is going to be different than any group I've ever worked with. I think we will be making recommendations that become law, that become sustainable change. And I'm very proud that here locally, we have been doing some of this work for several years. There are many things that we've talked about, just like I think Chief Blue mentioned this, using citations, criminal summonses rather than arresting people, doing things to keep people out of our local jail that are now all the rage around the state and nationally. And those were things we've been doing for many, many years here in Orange and Chatham counties. I wanted to touch very briefly on stopping regulatory stops or ending that. That's another thing the task force has talked quite a bit about, and it's another area where there's some pushback that we've gotten because, and even the Attorney General himself noted that one of the real challenges in that, to do it statewide, is to come up with a way that there can be proper compliance with those regulations without having regulatory stops. And, you know, most of the examples of ways to do things by decriminalizing them, it becomes something administrative that requires some sort of fine, some sort of cost, or taking away a privilege, you know, suspending a driver's license, something of that nature. And we're trying to avoid doing that too, because those are some of the policies we've had in the past in the state that have created the problems we have today, some of these disparities. So Josh, I think, was really, it was really smart of him to point out to us that we've not only got to recommend ending the stops, we've got to come up with a solution to how we enforce these regulations, because some of them are very important. So we're trying to tackle all of these issues. Again, I have provided the task force with examples of a lot of things being done here in our local jurisdiction. And some of these things are done in other places, but I want everybody to know we've done a lot of work over a lot of years. We have a driver's license restoration program. There are other places that have it too, Durham County, I think New Hanover County, Wake County may have it now, but it's something we've been working on for quite some time. We have a great pretrial release program. And because of COVID, as Chief Blue said, we found new ways to keep people out of jail. We're already in discussions about how can we sustain that when we hopefully get past the COVID era. So I think there's a lot of things happening locally that are exciting, that are going to be copied at a statewide level or used in some way at the statewide level. And then I'd just turn it back over to Anna at this point if you have anything else you want me to specifically talk about.
Okay, great. I would like you to touch on whether or not this issue of police advisory boards has been discussed, because that's something we talked about last week. And after you answer that, then I have a couple questions, but I invite folks to put any questions that they have in the chat or raise your hand. Would you want to, has there been any discussion about police advisory boards?
There has been, and we touched on that just a little bit in the full task force meeting on Friday. It's one of the other working groups that is tackling that problem. I can't remember if it's working group number 1 or 2. Those are the 2 working groups that are primarily engaged in law enforcement issues. My working group's more of a court issue working group, but that is one of the issues that they're working on. And like a lot of these issues, there are a lot of moving parts, a lot of different opinions about how it should be done. So they're not at the point of making a recommendation to the full task force yet, but I think they will have a recommendation in the coming week. So there will definitely be a recommendation about that coming out of the governor's task force. I just don't know what it's going to look like at this time.
Okay, great. Thank you. One question I want to respond to right away. Someone asked if we could expand on the last bullet that talks about ending criminalization of gender-based violence. So the definition of gender-based violence is physical, sexual, or psychological harm or suffering to women. And so, and it could be in public venues or private, even in the home. So examples of that would be intimate partner violence, trafficking for sex, physical punishment, sexual, emotional, or psychological harm, food deprivation, economic violence. So that's really getting into gender-based. That's what we mean when we say gender-based violence in our agenda. Also, one question came saying that although Chapel Hill Police Department has avoided relationship with ICE, what about our Sheriff Department personnel? So we did send our agenda to the sheriff, and we are we'll have an opportunity to hear from the sheriff directly. We'll be doing something across Orange County. Hopefully we'll have a similar session with him, but I don't want to preclude Chief Blue from if you have a quick response to what about our Sheriff's Department in terms of ICE.
Yeah, I'll just quickly say, I know on the, at the street level, their philosophies are just like ours. No question about that. I mean, I think one of the realities is that once you end up in the jail, you're in a variety of databases that go beyond the sheriff's ability to manage. So a big interest that we, particularly with this discussion around immigration, is keeping people out of jail. Because once they get there, the sheriff's ability to keep federal agencies from accessing that database becomes really impossible for him to manage. So he can speak much more wisely than I about what happens at the jail, but I know that his deputies share the philosophies that our officers share about those local relationships being vital, and that we cannot have the folks we serve think that those interactions with us are going to lead to them being deported or otherwise encountering federal immigration authorities, because that's just not what they support, and it's not what we support.
All right, thank you. And Jim, this one's for you. It says that a lot of the items may require some additional revenue, or will they? To what extent will we, if those additional revenues are required, how will they be implemented local and county level in terms of more generous social service supports financially? Any comment on that, Jim?
Well, I don't think there's any question. Anytime you change the way you try to achieve goals, it usually takes some additional funding. And I always think it's wrong to mandate change without appropriate funding. I think that's one of the great challenges in all of this. Anyone who's ever worked in government, whether it be local, at the state level, at the national level, knows how difficult it is to come up with those dollars to do the things that you think are important. I think that's probably where the community becomes so important, and expressing a desire for change and letting your local and state and of course national leaders know. But I think locally, if you let the local leaders know that we need to reassess the way we're spending our dollars, that makes an impact. I know many people in local government, whenever you talk to them about an issue that's important to you, it matters to them. And I think that's one of the things we can do as a community, is express to our leaders that this is important and that they need to be willing to make changes.
Great, thank you. Perfect segue here. We don't have any other questions in the chat, and I'm looking here and I don't see any hands raised, and we're just at 3:27. So I want to just really thank our participants for being with us today. We want to share this next steps chart that we talked about last time. And, we are still reviewing the agendas. We have meetings upcoming with the other police departments in the county, both counties actually. We're going to try at the end of these conversations, we're going to try to figure out what's actionable and what's within the purview of individual jurisdictions. What things can we really impact? And we're hoping that we can continue to get input, and we're looking for input from the community. And we're going to be really interested in what the governor's task force, as well as our Chapel Hill task force, are doing in terms of recommendations. And we had this up from the same chart last time. I think the applications for reimagining the community safety task force are now closed. And I don't know, Chief, if you want to add anything in terms of what that task force looks like and what their schedule or their timeline is.
I'll just quickly say that folks can go on the town website and see a list of the task force appointees. Council made those appointments this past Wednesday night. So if you'll go to the town calendar and look for this past Wednesday's business meeting, the last item on their agenda was that appointment that evening, those appointments that evening. So staff has been reaching out to the task force members to make them aware that they've been appointed and to begin talking about their meeting schedule. We're also reviewing some outside vendor bids to help support the task force and guide their work. So we expect things to get up and running in the next week or two. And I imagine, that much of where the work goes, although the council's charge will guide the task force, so too will the curiosity of the task force members, I'm sure. So I think folks keep your eyes up to engage with them and to provide input with them. I could imagine that they might want to participate in some opportunities like the one we've done here today. So stay tuned. And as I mentioned, there's a centralized web page that will also kind of catalog their work product and share work schedules or meeting schedules and so on for them. So you can go to the town website and find that.
All right, well, perfect. Thank you. I want to again give my profound thanks to our district attorney for being willing and to join us today. I know it was a personal challenge for you, and we just really appreciate your willingness to join us, along with Kate Finhagen. Appreciate the work that you're doing on a day-to-day basis, and as always, your willingness to interact with the community. And of course, Chris, thank you, Chief Blue, for being a part of parts 1 and 2 of our conversation. And we'll be continuing. I do want you to please share the fact that both these sessions are recorded and they're out on our website, along with the Counselors Not Cops link, so that even though we had a maybe disappointing number of folks on the call today from last time and from what we hoped, hopefully we can drive folks to this important conversation and